Hi, this is Cassandra Fletcher and Tony Marks, and we are doing our Unit 3 PowerPoint Hangout assignment. We are having some difficulties figuring out how to share the screen without making it flash according to who's talking. So I'm going to control the PowerPoint by sharing my screen, and she's going to actually present the PowerPoint. And I'm going to share my screen now. I know it's going haywire. Sorry. Okay.
All right. So again, we're looking at nursing excellence, magnet recognition, and how nursing facilities or hospitals incorporate the characteristics of a magnet recognized facility. All right, so the Magnet Recognition Program. Magnet Recognition Program was created by the American Nurses Credentialing Center in 1990 to recognize hospitals and other healthcare organizations with outstanding nurse workforces. Magnet status is based solely on nursing practices and standards maintained by the hospital. Since 1994, when the first organization earned magnet status, the ANCC has been working towards improving nursing quality throughout the world. Magnet hospitals have higher percentages of satisfied registered nurses, lower RN turnover and vacancy, improved clinical outcomes, greater nurse autonomy, and improved patient satisfaction. Nurses in magnet facilities are often more engaged in their work, which correlates to better outcomes. In 2010, it was estimated that magnet facilities had 7.1% fewer safety-related incidents and accidents than the industry norm. Magnet employees are more engaged and tend to be psychologically committed to the organization, loyal, more productive, and less likely to leave. The higher the engagement level, the better an organization performs. From a business standpoint, this power of engagement is one of the most significant benefits of magnet recognition. Magnet designation also provides financial benefits to healthcare organizations by raising awareness in the community and opens the door to increase philanthropic gifts, both for nursing and other areas of the hospital. All right, so again, magnet recognition. The original magnet research study conducted in 1983 identified 14 characteristics that differentiated organizations best able to recruit and retain nurses. This was done during the nursing shortages of the 1970s and 1980s. These characteristics remain known as the ANCC forces of magnetism that provide the conceptual framework for the magnet appraisal process. So these 14 forces of magnetism are the quality of nursing leadership, organizational structure, policies and programs, professional models of care, quality improvement, consultation and resources, autonomy, community and healthcare organization, nurses as teachers, image of nursing, interdisciplinary relationships, and professional development. With the new magnet model, it contains 5 basic components that actually incorporate these 14 forces of magnetism. For a hospital to achieve magnet status, the institution must meet an extensive list of guidelines, all of which fall under the 5 basic model components: transformational leadership, structural empowerment, exemplary professional practice, new knowledge, innovations and improvements, and empirical outcomes. With transformational leadership, that just implies that today's leaders are required to transform their organization's values, beliefs, and behaviors. The transformational leader must lead people to where they need to be in order to meet the demands of the future. With the structural empowerment, solid structures and processes developed by influential leadership provide an innovative environment where strong professional practice flourishes and where the mission, vision, and values come to life to achieve the outcomes believed to be important for the organization. The exemplary professional practice, that entails a comprehensive understanding of the role of nursing, the application of that role with patients, families, communities, and the interdisciplinary team, and the application of new knowledge and evidence. With new knowledge, innovations, and improvements, organizations have an ethical and professional responsibility to contribute to patient care, the organization, and the profession in terms of new knowledge, innovations, and improvements. With the empirical outcomes, those focus on structures and processes with an assumption that good outcomes will follow. Outcomes need to be categorized in terms of clinical outcomes related to nursing, workforce outcomes, patient and consumer outcomes, and organizational outcomes. So the first organization we're going to look at is Duke University Health System. Magnet designation is the gold standard for recognizing organizations that achieve excellence in quality care outcomes. Duke University Health System is one of only 16 magnet health systems in the country and one of only 3 in the state of North Carolina. In seeking magnet status as a health system, Duke Nursing and Duke University Health System leaders focused on best practices, especially those identified by the ANCC. All 3 hospitals, including Duke University Hospital, Duke Regional Hospital, and Duke Raleigh Hospital, they all 3 demonstrated excellent quality results independently and aligned numerous best practices at the health. Just look over a couple of the magnet qualifications for the health system. Under the exemplary professional practice, looking at EP1, which is how nurses develop, apply, evaluate, adapt, and modify the professional practice model. The Duke University Health System professional practice model guides nursing's professional practice and represents all of Duke Nursing. The model is based upon the Duke University Hospital nursing mission, vision, and values. The initial process was to position the patient, family, and community in the center and embed the resources that Duke University Health System nursing has in place to optimal outcomes. The concept was that patient, family, and community are supported by nursing practice. In turn, nursing practice is supported by the concepts of leadership and management, research and outcomes, and education and development. EP4 says to describe and demonstrate that the structures and processes of the care delivery system involve the patient and/or his or her support system in the planning and delivery of care. With EP4, the Duke University Health System professional practice model provides a caring-based framework for the delivery of care to patients, families, and communities with the goal of achieving excellent outcomes using consistent professional nursing values and expectations. The implementation of the professional practice model ensures that Duke Nursing is recognizable, consistent, and exemplary across the health system. This supports the evidence of the value placed on the group in terms of planning care in the diverse locations patients are served. The organization recognizes the importance and the influence of the family and community on a patient's well-being during times of health and illness. All right, looking at the transformational leadership, TL2 states how nurses at every level, the CNO, the nurse administrators, and direct care nurses advocate for resources, including fiscal and technology resources to support unit and division goals. At Duke University Health System, nurses are involved at all levels of the budgeting process and actively advocate for resources across practice settings. The CNOs are members of the Executive Medical Committee to their respective facility and are actively involved with review of budgetary performance at the highest level. As annual budgets are projected in cooperation with the finance department, the CNOs work with the ACNOs, directors, and departments to determine needs for the coming fiscal year that should be captured as the budget is built. To accomplish this, the directors work closely with the assistant directors or nurse managers, who in turn provide review of each nursing unit. This review is completed by engaging staff nurses for capital and supply budgets. TL4 looks at the processes that enable the CNO to influence organization-wide changes. The advocacy and influence for nursing, which is basically the role of the CNO. So the effective CNO must integrate nursing science, business principles, organizational behavior, and resource management to participate as a full partner in managing and leading the contemporary healthcare organization. Managing the delicate balance between power, motivation, and relationships is critical to driving system and organization-wide changes that are actually sustainable. At Duke University Health Systems, the Chief Nursing Executive and CNO of Duke University Hospital is charged with exercising leadership responsibility over the practice of nursing as a member of the executive team, ensuring consistency in nursing practice standards, and facilitating an interdisciplinary team approach to the delivery of care for the entire health system. The CNO of both Durham Regional Hospital and Duke Raleigh Hospital are both charged with exercising leadership responsibility over the practice of nursing as a member of the executive team, ensuring the consistency in nursing practice standards, and facilitating an interdisciplinary team approach to delivery of care at both of their respective hospitals. And looking at structural empowerment, SE1 asks to describe and demonstrate the structures and processes that enable nurses from all settings and roles to actively participate in organizational decision-making groups such as committees, councils, and task force. So at Duke University Health System, nursing participates in multiple shared governance councils and committees. Minimum staffing plan requirements and mechanisms are outlined in each area's scope of care. These plans provide adequate staffing to enable nurses to participate in committees, attend staff meetings, participate in performance improvement activities, and attend educational activities. SE11 asks to describe and demonstrate the structures and processes used to identify and allocate resources for affiliations with schools of nursing, consortiums, or community outreach programs. Affiliations with schools of nursing, planning, implementing, and evaluating community outreach programs, initiating the development of new regional service or educational consortium, and developing the next generation of RNs and allied health practitioners are all efforts aligned with the Duke University Health System core triple mission of patient care, education, and research. The system's nursing fully embraces the larger mission of education, demonstrated through the provision of clinical experiences. The nurse professional practice model clearly includes nurse involvement with students in the areas of professionalism. This includes the nurturing of students and the demonstration of professional practice every day, every patient, and in every setting. So the second organization we chose to look into was Thomas Jefferson University Hospital. When you think about nurses at Thomas Jefferson University hospitals, think quality, superior patient care, innovation, and excellence. 6 out of 9 hospitals are designated magnet organizations. 6 hospitals have demonstrated excellence and quality of care, earning magnet status for at least the last 3 years. They first received recognition from the American Nurses Credentialing Center in October 2013. Nurses at TJUH are very hands-on and involved in the healthcare practice. From scheduling to budgeting, they are all a team to achieve satisfaction. The CNO works with the nurse directors, and the directors work with the managers, and then managers with their staff using a shared governance model to successfully achieve goals. The channel of communication is multi-directional, and all opinions are welcome. The CNO has an open door policy where the nurses and other nursing support staff can come in and talk about things that have not been able to be resolved at the lower levels. Thomas Jefferson University hospitals use a decentralized structural structure that is both vertical and horizontal. They encourage use of horizontals as best possible to resolve conflict, and if the conflict cannot be resolved, they use a vertical approach. They offer orientation and nurses as teachers to help foster professional growth to help empower their nurses. Exemplary professional practice is evident in many of today's leading hospitals. Nurses have significant control over the staffing and scheduling processes and work collaboratively with interdisciplinary partners to achieve high-quality patient outcomes. Peer validation, nursing practice model, code of ethics, Bill of Rights, professional practice model, care delivery system, interdisciplinary care, a culture of safety are all used in TJUH to help achieve exemplary nursing practice. All right, so when we look at what kind of leaders are necessary to achieve magnet status, to reach magnet level recognition, the journey begins with the transformational leader. Great leaders provide great structure, leading to great nurses with great knowledge and innovation, ending with great outcomes. The transformational leader establishes relationships and engages others to work together to meet a common goal through strategic planning, advocacy and influence, visibility, communication. Having strong, high-quality nursing leadership has been identified as a key factor in the ability to attract and retain nurses. Leadership has to listen and be responsive to the needs of their nurses to retain them. High-quality nursing leaders have the tools necessary to promote change and cultivate relationships among the executive level administration, middle managers, and direct care nurses. In order to tap in on the tools, organizational structures should provide necessary support for nurse leaders to obtain graduate level degrees or attend focused leadership programs. Transformational leaders can objectively evaluate the current climate of their organization and evaluate if the needs of their patients, families, and communities can be met. They work alongside executive leadership to propose organizational changes. Transformational leaders should also be able to develop a vision, develop commitment and trust, as well as have certain management styles. A vision of the future and what the healthcare organization aspires to is guided by the nursing executive team and shared with all of the stakeholders. A clear, positive vision of the future helps to energize and inspire the nursing team. The vision should align with the organization's strategic plan, as well as the strategic plan of nursing. The type of leadership within an organization is directly related to the level of organizational commitment. A supportive relationship builds quality leadership. These leaders develop trust by having clear, consistent two-way communication. Direct care nurses who develop trust with their leadership are committed to the organization's vision and goals. Vital to consumers as well as nurses. This is obtained by placing concern for the patient's needs at the forefront. Participative management is a style of magnet facilities. This style gives everyone a voice in the delivery of nursing care, programs and policies affecting them. Transformational leaders should remain visible and accessible, continuing to build on trust. Communication, these leaders disseminate information through unit and organizational councils. So in summary, creating and sustaining a culture of excellence is what it means to be on the magnet journey. The process alone is very lengthy and requires dedication, but it is worth the highest and most prestigious distinction a healthcare organization can receive for nursing excellence and high-quality patient care. Being magnet recognized encourages organizations to promote quality and a milieu that supports professional clinical practice, identify excellence in the delivery of nursing services to patients, and provide a mechanism for disseminating best practices in nursing services. All right, and listed here are our references. Thank you for your time and your attendance.
I gotta come back to the screen to stop sharing. Did I stop sharing?
You stopped sharing, but we're still live.
Okay, I'm stopping live.